Hi there, I'm John.
I'm Laura, and we are sharing our infertility story, our IVF journey.
As infertility man.
As infertility man. So you can follow us on social media, or if you want to hear how this story ends, if we ever get to the end of the story, then subscribe.
Wow.
Ends.
Anyway.
That's going to be years down the track. So yeah, if you want to watch us suffer through infertility for years, feel free to subscribe. That sounds so exciting. Like,
longest series ever.
That actually doesn't sound like much fun. We're fun though. Like, follow us, it's fine. Yeah. Okay, so we got the results back from the endometrial test.
Yes.
And I can't say I'm surprised. Just waiting for my turn. I think there's a lot of other women here having transfers, which I am obviously not. So that's a bit weird, but it's all good. So I just had my endometrial test done. It's funny, I think I had a biopsy that didn't go so well, that really hurt, because that did not hurt at all. I didn't feel a thing. So that was a good one maybe, but yeah, so good test today. We'll wait and see what the results are. Maybe, I kind of hope there'll be something in there that gives us some answers, but if not, then we just keep pushing forward. So I can't say I'm surprised. So, well, first of all, with the ERA, which was endometrial receptivity.
We'll show you the results too.
Yeah.
We'll show you what they look like.
Somewhere.
We'll put them there.
So basically what we expected is that my receptive window is very average and normal, and therefore doesn't tell us anything different.
So it's fantastic.
But we knew that already, because I've already conceived.
Yes.
And actually conceive every time we transfer an embryo.
Yeah.
So now the results of the Emma and Alice. What?
Yeah, no, that's right.
I don't know what he's thinking about right now. No. Okay, so the results of my Emma test.
Can I read them?
Sure. So you can see
the most important one is the 0% lactobacillus.
That's the good one, that you need lactobacillus. Yes. And actually, my research tells me that lactobacillus crispatus is the most important one for crispatus? For fertility.
Right there. Yeah.
So yeah, there's zero good bacteria.
Zero good bacteria, and as we understand, that's the bacteria you need to maintain a healthy pregnancy.
So yeah, not good.
Streptococcus, 51.13%.
So that's quite bad.
Anaerococcus, I'm giving these a crack, by the way, 20.8%. Bacillus, 6.93%, and just others, 21.14%. So 100% of everything else, but the bacteria.
And I should say that all the bacteria that is there is bad bacteria.
Is this, yeah.
Same with essentially the chronic endometritis test, Alice test, just basically streptococcus 50% and everything else.
We are definitely not talking about endometriosis. This is endometritis.
Oh, well, that's a whole other thing. So what this indicates is that I have chronic endometritis.
Yes.
Which is not endometriosis. I've had actual medical nurses and doctors get this confused.
Yeah.
So definitely endometritis.
We've had discussions about this a lot when we've spoken to different professionals.
Yeah, because we've spoken to a few people, naturopaths and stuff like that, anyway, so basically, the results are quite bad.
So these things, you'll have the results and they give you an interpretation of the results.
Do you know the worst part about this though is that it takes about 5 weeks in Australia for the results to come back, which is such a problem when you consider that a woman's cycle is 4 weeks. So that means you always, because it's a 5-week turnaround,
you miss a month.
You miss it takes 2 months.
2 months, sorry.
You can't do anything for 2 months while you're waiting for your results. And the test has to be done on a certain day of your cycle, which really means it takes 3 months to get the results back. And
which, when you're aging.
Well, aging, but also just I also think, how can a result from 3 months ago still
help you
be
now?
Accurate?
Yeah. Help you now.
It just doesn't make any sense to me, because, okay, so the next step is suggested therapy, antibiotic therapy. So they suggest amoxicillin.
The interpretation
of
your result.
That's essentially what you said, is that there's bad bacteria.
And they just
How do you say that?
clavulanic acid.
So they've essentially suggested antibiotics, which is the treatment that most people do for endometritis. So basically, I'll be on a course of I'm not sure, like I think it's going to be like 7 days.
Yeah.
I have to check what I've been prescribed of antibiotics, and then I'll do probiotics. So there's vaginal probiotics and oral probiotics that I'll be taking afterwards. So to hopefully now, from what I understand, like most people get better quite quickly after a course of antibiotics. So hopefully that will be the case for me. So anyway.
The thing is with antibiotics is they don't really discriminate between what they're actually taking out. So if there is any good stuff,
yeah, which is showing up as zero,
it potentially would go as well. So then you actually end up. Anyway.
I'm not someone who takes antibiotics very lightly. I've rarely taken them in my life, so this is kind of a big deal. But
it's quite huge.
I will say, coming back to sort of the emotional impact of this, is I feel pretty bad because I think what happened to our transfers was this, and this is something that could have been avoided if we'd had the tests before we did the transfers.
Mm-hmm. It does. I guess hindsight is 20/20, but advocating for yourself in whichever way that looks is just so important.
The tricky thing with this one is I did feel that I advocated for myself. I asked for the ERA. My doctor responded to that question, and what I should have asked for was the endometrial or the emerinalis.
Yeah.
But I still feel like she could have volunteered that information. But anyway.
I guess it comes back to as well what they're focusing on.
There was no reason to think anything was wrong.
No,
I just had a successful pregnancy.
100%.
There was no reason. In my research about endometritis, some of the things that really cause it are like, having a C-section and all kinds of things that I didn't have during my birth, but I have had a lot of intervention in that area, I guess. So anyway, that's the situation. I mean, in a way, it's good to have some kind of answer.
Yeah.
So, and we've also decided that in the meantime, since we can't do transfers and it takes 3 months we're going to have to do the antibiotics and then retest, and it's going to take another 3 months. So we've decided in that time that we're going to continue to collect eggs and hopefully use up the 4 vials of sperm that we have left in the freezer. So since we're kind of stuck for at least 3 months anyway.
Yeah, that's at least that time frame.
So we're going to just keep collecting eggs while we keep working on that.
Collecting eggs until we, similar to our first, before with Addie, is just getting enough eggs to be able to use whatever sperm.
Yeah, well, we've already used that 1 straw of sperm, so we've got now 3 left.
Yeah.
So, we'll see if we can get enough eggs to do that while we're waiting, because we can't transfer. So, we can't transfer until we know that things are right.
That's right.
So,
we have decided that.
We know that for sure.
Yeah.
Yeah. All right, well, that's what we're going to do.
Cheers.